We have augmented reality neuro-rehabilitation therapy.
Hello everyone, my name is Albert. AUGMENTx provides stroke patients with an augmented reality rehab therapy that has the potential to accelerate their recovery. I want you to meet Louis. A massive stroke left him paralyzed on the right side of his body. He now faces lifelong rehabilitation in hopes to recover his functional independence. With our aging population, the burden of stroke will rise very quickly, and 1 in 6 of us will have a stroke in our lifetime. Our digitized augmented reality therapy has the potential to accelerate stroke recovery. Let's say this model stroke patient has left-sided paralysis. After putting on the augmented reality headset, he sees a virtual left hand moving in mirror image to his own functional right hand. Studies have shown that when patients watch their impaired hand or arm move normally again through visual illusions like this, then their actual impaired hand and arm starts to move with more speed and better coordination. So why is AUGMENTx better than what's being used today, which is the mirror box? Although mirror box therapy has been shown to accelerate stroke strength recovery in our patients, patients' access to trained therapists is limited. And even after they learn the therapy, their compliance rate at home is low. That is partially because they have no way to track their performance and progress objectively at home. And also, the physical mirror box in the picture is a bulky and heavy object for stroke patients to independently set it up and put it away after each use. By digitizing the mirror box therapy, AUGMENTx solves these problems. We provide on-demand access to therapy with a digital voice assistant who then instructs and teaches the patient how to do it on their own. We achieve better compliance through patient engagement tools, and we provide patients automated progress reports. And above all, our small form factor compared to all of our competitor products allows patients to take the therapy anywhere they want and to do the therapy anytime. We have a diverse and talented team with extensive experience in our respective fields of medicine, engineering, user experience design, and finance. We are very committed to building clinical evidence and improving patient outcomes. We started in October of 2016, and we are now trying to finish our preclinical development before the end of this year. We're looking for funding and partnerships to run our first clinical trials and to deploy our clinical program. As a physician, I truly believe our therapy has the potential to help stroke patients regain function and renew their quality of life. Thank you.
Thank you. Questions?
So if I was looking at these therapies, why would this be a compelling experience for me?
The compelling experience of this therapy. So augmented reality superimposes virtual elements in your real world. So and it's an immersive experience where it's a first-person view, whereas other VR or mixed reality therapies are usually either takes you away from your real world or it gives you a second-person view or a third-person view. I think our system is more compelling because it's the first-person view.
So what exactly is the interface? I mean, what is someone using, and particularly for different age groups, like the elderly, how would it work with elderly?
Sure. So currently, our prototype is deployed on a Microsoft HoloLens, which is a head-mounted display. However, we've strategically engineered our system in a way that our sensor and the computing unit can interface with TVs, cell phones, iPads, and with Apple, Microsoft, and Google jumping into augmented reality, there are going to be many devices that are going to come on to the field and available to patients and the general public. And we want to seamlessly be able to integrate our therapy to various display panels. So depending on the patient's proficiency with technology, we can interface with different display panels.
quick question. Who do you see as your competitors?
Sure. So there are already a lot of players in the virtual reality and augmented reality field trying to provide therapy for patients. And when you look at specifically stroke patients, one of the biggest companies is MindMaze in Switzerland. But I think we are differentiating ourselves from them in that they are mainly focused on acute phase after stroke and providing, and their system currently is a big tower. We miniaturized all of that into a small form factor so that patients can get it during the acute phase, take it to their rehab hospital, and take it to home and keep it. So that's our hope.